Ethiopia is located in the Horn of Africa, landlocked by bordering countries of Eritrea, Djibouti, Somalia, Sudan, South Sudan, and Kenya. With a population exceeding 90 million, Ethiopia is the second most populated country in Africa. Even with such a significant population, the potential healthcare availability to citizens is astoundingly subpar. This, in turn, leads to diminishing health of the overall population. A considerable portion of threats presented to the public come in the form of infectious diseases. Our efforts believe that by focusing on the healthcare of Ethiopia, we will be able to improve the overall well-being of the nation and its citizens. With roughly two-thirds of the population at risk, an average of 5 million cases a year, and cause of 70,000 deaths annually, malaria is the primary concern within Ethiopia. Being a parasitic disease contracted through mosquito bites, there are multiple factors that contribute to the severity of outbreaks and related health concerns. With mosquitoes thriving near stagnant water in warm regions, improving the infrastructure of Ethiopia's water supply is of great importance in the effort to combat malaria. Only 34% of Ethiopians have access to an improved water supply, while most citizens rely on gathering water from shallow wells and small watering holes that rely on runoff from the surrounding area, resulting in vast contamination. The lack of water sanitation, coupled with the reliance on stagnant water sources, combine to increase the prevalence of potential malaria-carrying mosquitoes. Because of this problem, it is clear that an effort to increase Ethiopia's improved water supply is necessary for the health of the nation. Along with these infrastructure improvements, educating Ethiopians on how to avoid the disease, along with mass provision of mosquito nets and insecticides to citizens at highest risk, will combine in an effort to significantly decrease the infection rate of the disease. Along with the poor infrastructure concerned with water, healthcare infrastructure within Ethiopia is also significantly lacking. Because of this, it has been established that around 80% of deaths in Ethiopia are the result of diseases that are preventable and treatable with proper healthcare. Acknowledging the absence of significant permanent healthcare, it becomes apparent that semi-permanent medical outposts are crucial to delivering medical assistance to those in need throughout the country in order to decrease these mortality statistics. This astounding statistic illustrates Ethiopia's need for an increased medical presence throughout the country. In addition, our efforts aim to increase the treatments available to those already infected with malaria. We would enact this effort by increasing the number of doctors deployed in high-risk regions, partnered with large numbers of vaccines and other medical supplies necessary to fight the disease. In addition to combating the disease by targeting the source, outside factors must be taken into account as well. The prevalence of HIV/AIDS within Ethiopia is also a concern to the effects of malaria. It has been found that HIV has a negative influence on those infected with malaria. HIV-positive individuals are prone to increased severity of the disease, along with a higher risk of death as a result. Anti-malarial treatments also have less of an effect to combat the disease in these individuals. As a result, decreasing the transmissions of HIV/AIDS will assist in the decrease of death caused by malaria infections. We hope to accomplish this decrease by providing condoms and education on HIV within underdeveloped regions. By assisting the fight against HIV/AIDS in Ethiopia, the mortality rate of malaria will see a directly related decrease as well. As with all plans for change, there are risks and consequences of these planned actions. The most notable risk would be the deployment of doctors and medical personnel to regions at high risk of malaria transmission. This deployment will undoubtedly put these individuals at risk of obtaining and enduring the effects of the disease. Furthermore, the installation of more advanced water infrastructure will require considerable maintenance over time, resulting in more money being needed in the future. To implement this development plan, our organization plans to disperse the total funding of $5.5 billion amongst various aspects of the effort. Studies estimate that sufficient water infrastructure improvements would total around $450 per capita. Using this estimate, the use of $4.5 billion would go towards providing advanced water infrastructure to roughly 10% of the total population and 15% of the population at the highest risk of contracting malaria. With mosquito nets costing about $3 to protect 2 people, we would be able to provide nets to the entire at-risk population for $100 million. $500 million would be put towards the deployment of medical personnel along with vaccinations and semi-permanent medical stations. The remaining $400 million will fund the education of Ethiopians on malaria and HIV/AIDS, as well as provide condoms to at-risk regions. Through these combined efforts, we plan to increase access of treatment and number of healthcare workers by 20%, while decreasing both the infection and death rates of malaria by 35%. Our vision for Ethiopia after the successful implementation of the development plan is for the nation to be significantly more healthy, resulting in greater family and job stability, strengthening the economy as a whole. These results will help to improve the overall quality of life of the citizens of Ethiopia.